Okay.
Good evening, Scleroderma family. I have the great pleasure of welcoming Dr. Ritika Arora. I've known her for a couple of years, and trust me, she's my go-to person whenever I need advice. She's the best person who can come up with genuine advice and genuine feedback. I've never had to second guess whatever she says. Just a small
Thank you.
brief on Dr. Ritika. A communicator who can relate well to dental patients, having proven ability to prove that dental practices are continuously updated to provide first-rate care to patients and their families. A confident healthcare professional with more than 15 years of track record of successfully diagnosing and treating patients with dental conditions. Able to work as a part of dental team and has flexible approach to work. Dr. Ritika Arora was born and brought in Delhi. She's done her bachelor's in dental surgery from Delhi. After 3 years of working in clinical practice, she moved to Mumbai, where she's done her master's with DY Patil. In 2009, she became the fellow of International College of Continuing Dental Education. Her successful career of cosmetic dentistry has led her into the world of facial aesthetics in 2014, with Dr. Ritika Arora being a dentist and an aesthetic eye well suited to evaluate symmetry and aesthetics of facial expressions. Since then, she has extended her knowledge to this field by completing an international master's course in skin laser therapy from Singapore and certification in aesthetic medicine from Hong Kong. She's also a member at American Academy of Aesthetic Medicine. A business entrepreneur, Dr. Ritika Arora has been a co-founder and chief medical officer at About Face, an international aesthetic and anti-aging center at Mumbai, which is affiliated to Corplus Group Singapore. She is also associated. She was associated and was an ex-professor at head of department of periodontics and oral implants in Dental College of India. Over to you, Dr. Ritika Arora.
Yes, hi, good afternoon, good evening to all of you. And thank you for this opportunity to come and share my views. My name is, as Rashmi introduced, my name is Dr. Ritika Arora. I have a practice in Khar West, and I think she's already said. So I'm basically a master's in periodontics and oral implantology. And periodontics is one field which technically deals with mainly your oral tissues. That means anything to do with your plaque, calculus, gums. Though that's what my master's in, though I do everything in dentistry, especially cosmetic dentistry and all. But why this would be probably of more interest to me and for all of you who are in this community of scleroderma is because this is like how you have in dermatology we say that it's a skin condition. It also affects because the skin constituents are quite, so you have all the collagen, you have all the cells, and what little knowledge I have about scleroderma is all related to this, and so is the same configuration there in our mouth as well, which is it is there in our gums. It is the collagen plays a very, very big role in the gums, and not only in the gums, otherwise in the mouth as well. So, having said that, I'm sure a lot of depending on what stage of disease you are or what, um, how exactly has been your, the journey with this disease. I would like to today just talk very short and briefly about what are the symptoms that you should look out for when you are, when you are probably on this disease. Now, as I mentioned, I know this disease is related to your thickening or something to do with your collagen mainly. So there is a lot of things, there are a lot of changes which you might experience. Some may experience it less, some may experience it more, and it would also vary in degree. So one of the main symptoms is microstomia, that means which is difficulty in your mouth opening. Now this is happens because again there is a little bit of fibrosis, so your mouth opening becomes limited. What treatments can we do? I will come back to that later. Then the other thing which is one of the most common is xerostomia, or that is less of saliva production. So when you have less of saliva production, that means you have a very dry mouth. Now, a dry mouth can lead to, so all these symptoms would not really affect you directly. You may feel it's okay, I have a dry mouth, what's the problem in it? But what really happens is dry mouth means there is less of saliva production, less of saliva pooling. So as a result, now saliva can be beneficial as well as it can be harmful as well. Beneficial mainly because whatever food we eat, the lubrication in the mouth, the chewing, everything is assisted with the saliva. Now, if the saliva is less, that means your mouth is going to be more dry. So your chewing ability and a lot of other things would be affected. And not only that, it would lead you to more prone to, because saliva has the ability to wash away the good bacteria and the bad bacteria as well. So if you have a dry mouth, you're more prone to caries, you're more prone to periodontal disease. So these are the things that which is one of the most common symptoms. So you may have the best oral hygiene, and then you must be feeling that, why is it that I'm suffering from periodontal problems or gum diseases, or why am I suffering from cavities, where I mean, I brush my mouth 2 to 3 times a day. So this could all be related to a condition which is known as xerostomia, or loss, or in layman language, it is called that less of salivation or loss of salivation. So leading to a dry mouth. Then, other than that, again, because we were talking about fibrosis and stuff, it could also lead to a rigid tongue, which may make the swallowing or the speaking difficult. It could also lead to some TMJ issues, like again, so this is your joint. Again, too much fibrosis would probably limit. So we say it could lead to a pseudo condition where you're not able to open your mouth wide, and you could have difficulty again, which could lead to difficulty in chewing, swallowing, everything. Then if I have to specifically cater to the gums in our mouth, along with loss of salivation, which may make you prone to caries and stuff, there is a loss of gum tissue as well. Now, when there is a loss of gum tissues, your gums start receding. When your gums start receding, you start feeling that sensitivity. So this is another condition where everything is interrelated basically. So this is another condition which is very, very common in patients with scleroderma. Then sometimes there could be some discoloration or blanching of the skin, or they could be reduced mobility of the tongue as well. Like that means you're not able to move your tongue properly. So these are some of the symptoms, and this mainly happens due to excessive accumulation of collagen, which is again which comes to what scleroderma is a part of. So, how or what you have to mainly look out for is basically if there is any facial tightness or facial this thing, there are some face exercise which could help you. Then, in case of if there are less salivation, if there is less salivation, it could also lead, as I said, it could make you more prone to caries or something. So, there are a lot of oral over the counter products which are available, or even simple things, drinking a lot of water, making sure gargling after food, making sure that you are keeping your mouth moist. Simple things to stimulate salivation is something like a candy. Like even if you are using or one of those, you get a lot of products which help to increase the salivation. So this is something which could be very, very beneficial. And along sipping fluids regularly, that's also very important. um, Chewing gums, something like one of those sugar-free chewing gums, that would not only help in increasing the salivation, it helps the saliva to move around. Also, it would help in opening your mouth, the flexibility of the mouth. So these are things that you could probably look out for. um, there are sometimes there are some patches that could be seen, so you have to look out for any white patches. It's not that directly you can get any fungal infection or anything, but it is because that you are suffering from a dry mouth, and it could lead to further complications as well. Then brushing, flossing is very, very important. That is one thing that I could suggest for all such patients is we encourage a lot of use of the electronic toothbrushes, the powered one, those rather than the manual. That could be done. If you have a lot of gum recession, I would recommend using not a very hard brush. I would recommend using a soft brush. So these are very, very basic things that you need to look out for. Now, a lot of people have this myth. Now, this is about what symptoms that you see or what you could experience, or if you visit, most important, visit your dentist every 6 months because you might not understand when the gum is receding, but we will be able to suggest you. We could probably put you, if you have a lot of receding gums, we could put you on a desensitizing toothpaste from the beginning, like a Sensodyne or a Sensodyne active, so that you don't reach the stage where the sensitivity starts to creep in. Then comes, so this is all about what you could see, what you could experience, what you need to look out for. At the same time, if there is any treatment that needs to be done, it is important that you go ahead, because neglecting oral health or neglecting is just going to make it worse because you, anyways, don't have an oral hygiene. So, if you feel that you have teeth missing, you must replace them. If you feel there is some treatment can be done, you can be treated like any other patient as well. We just take care of the medications you are, maybe if you're on a lot of heavy dose of steroids or whatever, or pain meds, what you are, we just have to check into those. But what is the most important in your is that, anyways, we say you should visit your dentist every 6 months, but in your cases, and you need to tell your dentist that you are suffering from this so that they look out for these symptoms specifically. If you have reduced mouth opening or some TMJ problems, we advise you some exercises like taking two fingers in the mouth and slowly trying to open your mouth. And when these are things that you should look out when in the beginning itself, where you start feeling that, these symptoms are starting to creep in. So this is something that I wanted to share. Now, I would, if you have any questions or if you want me to discuss a particular topic, I could speak on that as well.
Yeah, so Dr. Cleaning, how important is getting your teeth cleaned?
Okay. Um, whether you have scleroderma or whether you are any type of patient, the myth that teeth cleaning would make your enamel weak, that is just a myth. The instruments or the machines that we use are ultrasonic cleaners. That means they have a vibration, but they do not scrape the tooth. They only remove the plaque and the tartar which is there. As I mentioned, because you have a possibility of a dry mouth or reduced salivation, what happens is the natural cleaning what other individuals would have with the help of saliva, you don't have that. Now, if you don't get a 6 months cleaning done, or in some patient, if they're severe cases, if you don't get a proper cleaning done, you are going to become prone to tooth decay. You're going to become more prone to any sort of when the gum recession is there, that means your roots are also exposed. So it makes you more and more prone to any sort of decay in the mouth, which is that can happen. And then we know that a decay could lead to nerve exposure, it could lead to root canal. There can be so many things. Also, sometimes these kind of issues, if there is too much accumulation of plaque or tartar, it may further enhance your receding gums, which could make you lose a tooth. So please take out that myth from your mouth that that you cannot get your teeth clean or you shouldn't get your teeth clean. Teeth cleaning is very, very important, and it becomes more and more important where you have a dry mouth condition or any symptom related to scleroderma. So it is very, very important.
Doctor, we also have, a lot of acidity. and plus, with the, as you said, reduced salivation. So, at
Yes,
times the patients tend to get a lot of bad breath
yes.
as a combination of both. So, is there any particular mouthwash that you should be using? Because, we've seen that OTCs like Listerine really do not help.
Yeah. So now, when it comes to bad breath, again, a bad breath could be related that you need to do a regular cleanup done. One is that. Secondly, over-the-counter products, I would recommend more of a Colgate mouthwash or a Plaque, Colgate Plaque's mouthwash. Listerine can be a little harsh for the patients. So I would recommend the Colgate Plaques. That one helps you. So after you finish your meals, I recommend that you start using that mouthwash. Use it 3 times a day also. That is fine. So that is not really a problem. And second thing, as what I mentioned, is because of the dry mouth, receding gums, I think all the patients of scleroderma or something should straight away switch over to a desensitizing toothpaste. Because the concept of a desensitizing toothpaste is not that it's going to act overnight, or you wait for your gums to start receding, then you will start using. Reason being that already, if you are prone to gum recession tends to make your teeth more sensitive. When it makes your teeth more sensitive, the all these desensitizing paste, they tend to reduce the sensitivity, but it takes a period of time. It's not that the overnight the sensitivity is going to go down. So if you start from the point where you see receding gums, at that time itself, if you start using a desensitizing toothpaste, it would help you in the long run. And there is no harm always using a desensitizing. Like nowadays in India, also you get so many options. You have Sensodyne, you have Colgate Sensitive. So you should from make it a habit to buy a desensitizing toothpaste. What was the second question you asked me? One was about teeth cleaning and about
Bad breath. Bad
bad
breath.
breath. Yeah. So, Listerine. So any mouthwash which has a little more flavoring or a little more. So Colgate Plaques has come out with a lot of options, and it is mainly to reduce the plaque and the bad breath. So that one really helps. If anybody experiences extreme sensitivity, they can also switch over to a Colgate sensitive or a desensitizing mouthwash as well. It would it does not make a drastic difference, but yes, it would help you, to control the sensitivity as well as help your bad breath. The other thing, while using patients who have extreme sensitivity or extreme gum recession and they are prone to sensitivity, what we recommend is that when you're using a desensitizing toothpaste, so you could use a Colgate sensitive, you could also use a Colgate sensitive rapid action or something. Then there is another brand which has been, there are a lot of brands. There's Hayden, there's Shy, there are 3, 4 brands. Main thing is take this toothpaste, apply it for like say around 30 to 40 seconds, leave it on your teeth and then brush. Let the toothpaste, let the fluoride in the toothpaste and the other desensitizing agents stay on your tooth for a bit, and then you can start brushing.
We have a question. What is the
Yeah.
ideal frame for teeth cleaning? And please comment on teeth whitening, please.
Okay. Ideal frame for teeth cleaning is ideally once in 6 months. Now, if you have a regular dentist, let them. So there are some people whose oral hygiene is so bad that we recommend them to get it maybe once in 4 to 6 months. Eventually, then when they start maintaining, then cleaning, then we say once in 6 months. There are patients who can even come once a year, provided your oral hygiene is good. But because you are a patient of scleroderma and you know that the symptoms may creep up, it is better to visit your dentist at least once in 6 months so that there is a proper track record of what's happening. Teeth whitening is something which, if you, is something maybe I might not recommend. So teeth whitening is something which is very subjective, anyways. It may depend on patient to patient. How teeth whitening works is basically the enamel which is there. It's like how we go for a face bleaching. It's basically got a lot of bleaching agent in it, and It can be done in office, it can be done at home as well. You get home whitening kits also. But if you are a case where you have a lot of gum recession or your enamel is wearing off, then I would not recommend you to go for teeth whitening, as it could make your teeth even more sensitive. It could increase the sensitivity of your teeth. Also, if there is a lot of recession, the white, the wow white feeling you might not get. If you really are conscious, there are some products. You could visit a dentist. We have these night bleaching trays where the concentration of the bleaching agent is very, very less. So you could use them and you would see results over a period of time if that is you're very conscious. Again, when you do teeth whitening, it's important you maintain your oral hygiene. There should not be any accumulation of plaque or tartar, because that is going to again turn your teeth yellow.
Got it. Thank you.
I
So,
I
uh,
think there are some more questions. Yeah.
yeah, I'll read it. Okay. Doctor, one question that is very, very common with everybody is with scleroderma, the mouth opening becomes smaller and smaller. So if you have extractions, right? Not all doctors are, because the mouth opening is small, and khas karke if you have your wisdom tooth which needs to be
Yeah, yeah,
extracted,
yeah,
right? So
yeah.
how is this possible to do it? Is it easy procedure? Is it painful? Because we have patients who keep on asking this question all the time.
Okay. So now, wisdom, I agree that you have a limited mouth opening. You have a very fibrous mouth when it comes to wisdom, for the wisdom tooth for us to see. Now, wisdom tooth extraction, again, nowadays the surgeons are very well trained. Like there are some, not only scleroderma, but there are a lot of people who are those tobacco chewers, pan chewers. They also have a limited mouth opening. So what happens is, firstly, the minute we give you anesthesia, it relaxes your jaw, so automatically your mouth opening would increase a little bit. So if it is, say, if it is reduced to 50%, maybe your mouth opening will become 60 or 70%. So in that case, it helps the surgeon to open your mouth wider and do the wisdom tooth extraction. Now, whether it can be done or not, it one depends how bad your wisdom tooth is. It secondly also depends how bad your mouth opening is. But it is in very rare cases that your mouth opening is less than two fingers. Then in those cases, yes, I agree, wisdom tooth extraction could be extremely difficult. Whether it is painful or not, whether it's you or any other individual, wisdom tooth, the extraction part is not painful. We give you anesthesia, it anesthetizes your lip, it anesthetizes your mouth, and what you feel is a little more pressure. But the nagging pain post the wisdom tooth extraction could be there. You could have swelling from 24 hours to 72 hours. So if you're working, if you have any activity, then we recommend that do it in a way which is planned. And we also nowadays, in extreme conditions where we feel the mouth opening is less, or so we enhance, we up, we give you medications, which there are a lot of medications which reduces the swelling post the wisdom tooth. So definitely you can get a wisdom tooth extraction done. It will not be painful, but yes, do expect nagging pain post the treatment.
Thank you. So next question comes that, ulcers are again very common part of scleroderma, be it
Yes,
mouth ulcers, be
yes.
it lip ulcers, right? Gum ulcers. And they are very painful. And if you're brushing your teeth or if you're using any kind of rinsing agent, your mouth stings. So what should be done in those times?
Okay, ulcers again, it's related to because of the dryness or whatever. So, if one of the things we ask the patients is to supplement your diet with a lot of vitamin C, because the vitamin C reduces B complex and vitamin C. One, it reduces the chances of mouth ulcers. It also helps to build up a little bit of your immune in the mouth. And when I say vitamin C, I don't say that you need to take it for like 10 days, 20 days. Make it a habit, supplement it in your diet. So that's one way of reducing mouth ulcers. The second is that you do again get some ointments or those numbing gels, which you could use. It's called, very commonly, there's a product called Mucopain or there are one or two more products, so it numbs the area. If an ulcer is very bad, today a lot of people who use a laser, like I have a soft tissue laser, you can go to a dentist, somebody who's equipped with laser, and they basically do a little bit of laser therapy, which would reduce the pain and help in the healing of the ulcer. So that is one thing. If you have a very painful ulcer, that's one thing you could do. Any dentist who's using a soft tissue laser would just treat that area with the laser, and the healing will happen more quickly. See, these are things which you are going to experience as a secondary to scleroderma. So there is the only way we can this thing is to complement your diet with a lot of vitamin C and B complex. Or if it is too bad, then visit a dentist with the help of the laser. We will clean it up and relieve it.
Thank you. Praveen, you have a question? You raised your hand.
Hi, hi,
Hi.
doctor. I'm Pravleen.
Yes, hi.
I have actually put
Yeah,
my question on the chats, but I'll repeat it here. So
sure.
I have got scleroderma. It's been 6 years now, and
Okay.
I am facing lately. I'm facing a lot of dryness in my mouth, and it is
Okay.
only at night, not during the day. So
Okay.
only at night while sleeping. So I have to keep getting up in between to have a sip of water. And if
Right.
I don't do that, then by morning whenever I wake up, it is the mouth becomes so dry that the tongue is dry, the mouth is dry, the throat is dry. So what
Right.
can
Right.
I do to reduce this dryness, or probably what can I use to reduce this dryness, especially at night?
Okay, so are you anyways doing anything to reduce the dryness? I mean, whether it is day or night? Are
Nothing
you taking
specific.
nothing? Okay. So I think maybe later, I don't remember what the chemist, the over-the-counter name of the tablets or mouthwashes are. Now, if you, so what we have to do is we have to activate your saliva a little more than usual, so that basically activate your salivary gland so that there is enough production of saliva. So there are some products which are available. I can put it later in the chat or pass it to Rashmi. And I would tell you, so if you start taking those products or those, as I said, the mouthwashes or the chewable tablets, once there is a memory of the saliva to keep increase or there's more production of saliva, it would even reduce at night. It will take some time. So we have to basically activate your salivation. Now, at night, maybe because you're sleeping, you can't make a conscious effort to increase it. But once you start using those medications or those chewable tablets, what we have to increase, it would over a period of time automatically increase your salivation and not disturb you so much at night.
Praveen, I hope your question is answered.
Yes. Thank you, doctor.
Okay.
So next question is, ma'am, due to my thin lips, my teeth are protruding out. I want to have braces, but my doctor said he will have to remove 4 teeth. Only then he can put braces. What should I do?
Um, Again, as I said, that there is a myth about getting cleaning done. There is also a myth that, if you remove healthy 4 teeth for the braces, um, it is not advisable. You may lose your eyesight, you may lose that. But if your mouth condition is such, for braces treatment, removal of 4 teeth is very, very common. If I'm sure that means your bite must be, the jaw alignment must be such that without removal of the teeth, you will not get a proper alignment. So you can go ahead, there's no problem. I myself have got 4 teeth removed to get a teeth alignment. And nowadays, it's very, very, they don't remove your teeth. It's a middle tooth which is removed. They would not remove a teeth which would come in your smile line. And at the end of the day, it would give you a better alignment of teeth. Now, alignment of teeth is not only important for the purpose of cosmetics, it is also important that, remember, you might later in life develop any gum disease, periodontal disease, or have conditions because secondary to scleroderma. And if that gets accentuated with not a proper alignment of teeth, the chances of you losing teeth will become more and more. There are more chances of you losing teeth. So if you have to get an orthodontic treatment done, please go ahead and get it done. It is important and it will help you later. So there is, for orthodontic treatment, there is a cosmetic aspect, there's also a functional aspect. And in your case, we have to keep in mind that the functional aspect is very, very important.
Got it. Doctor, one more question, which is there is my teeth is getting chipped very easily. I don't know why.
Chipping of teeth, again, because due to dryness, your enamel is probably very weak, and that is causing a lot of chipping. Now, chipping of teeth, we would have to see whether it is related to your secondary to scleroderma, or is there something, are you a night grinder, bruxer, or is there any sort of disease why your enamel has become very weak? I think you will have to visit a dentist, and then only they would be able to see what is the reason and recommend you the treatment accordingly. But if the teeth are chipping, it's probably related that your enamel is weak. Now, why is your enamel is weak? We'll have to figure that out. Is it related secondary to your scleroderma condition, or it is related to some other condition? Yes, I think there is someone asking me about
Uh,
dental implants.
yes.
Yes, so can dental implants be done or not? Now, again, it would depend what your oral condition is, secondary to scleroderma. Now, not everybody, see, if your mouth opening is restricted, there is no way we can do implants, especially for the behind teeth, because you need a certain amount of mouth. Root canals and dental implants require a certain amount of mouth opening because our handpiece should go in. And if you are a controlled patients where there is not much of, I would say, restriction in mouth opening, your oral hygiene looks fine, you can go ahead with dental implants. Anyways, your teeth, you know for the fact that your natural teeth also may have an X amount of life. So whatever you can restore with the help of implants, because implants means that there is not going to be pressure on the neighboring teeth. It's going to be a separate entity on its own. So you can try, but again, we would have to make sure that later you're taking care and you don't develop less salivation or xerostomia or something. We would have to take care and have a proper follow up of your oral hygiene.
So, doctors already answered question on white teething. So, we have my teeth, my gums have receded. Any remedy to
Yes.
stop further receding?
This is again a secondary condition to scleroderma. What I can suggest is desensitizing toothpaste. If your teeth are very, very sensitive due to recession, I recommend a toothpaste called Thermoseal RA, or you can use Hydent as well, and or Shy, SHY it's called. Uh, do not use a hard or a medium brush. Do not use an ultra soft brush because you need to remove the plaque. So a soft brush would be recommended. A lot of people, because they think that the brushing is more effective when you use a hard or a medium brush, but it also tends to cause a lot of gum recession. So it's important that you use a soft brush that's good enough. Use a desensitizing toothpaste. Can you stop it or not? It's very difficult because it will all depend on your scleroderma condition. This is one of the big main symptoms of scleroderma, secondary to scleroderma.
Doctor, you spoke about electronic toothbrushes or the battery operated toothbrushes. So, we are seeing so many in the market and they range right from 1,000 rupees to 5,000 rupees onwards, or even 10,000 rupees onwards. Any particular brand that you would suggest? And
Uh,
why is a powered toothbrush better than manual toothbrush?
Manual toothbrush is on a manual dexterity. Sometimes we can be, see, most of the time, most of us while brushing our teeth, I think out of 10, maybe two would be concentrating on brushing. The rest, you would be lost in your thoughts, thinking about something else, how the day has been, or at night it would be like, okay, you're tired, your mind is somewhere else. So sometimes you do not realize, are you using as much force is required or not? And we have to make sure in your kind of cases that the plaque is removed completely. And also the brush does somewhere do a little bit of massage to your gums as well. Now, when you use a power toothbrush, which is a soft one, now that is the speed is constant. The pressure is constant because there is a rotatory movement which is automatically happening. So while brushing, somebody could be brushing up, down. At least this way, there is a vibration which is cleaning your teeth. And even if you're lost in your thoughts, you are going to run the brush in your mouth completely. It would help effectively to clean from inside the plaque as well. What brand? It is entirely, you can start by using, see, it's again some from 1,000 to 5,000. Some of them are cordless, some are battery operated, you don't have to charge them. Some have, sometimes they have in one, they come with two nozzles. It's fine as long as all power toothbrushes do the same job. It's entirely, it's like a phone. Do you want to pick up the basic one or do you want to pick up an advanced one? What I would recommend also with a power toothbrush is a water flosser or a water pick. This is meant again to keep one, to massage the gums in between the gaps which is there between the teeth, at the same time keep it clean. So a water flosser or a water pick, which again is now very readily available on Amazon, it would probably cost you 2 to 3,000. It comes with two picks, two nozzles. So in a family, two people can use it. It has a water tank. So what a water pick does is basically it helps to clean. It's like a what we do like with the water spray we are cleaning. So it is constantly cleaning your gums with the water jet as well. So that is something I recommend.
Any particular
I
brand?
can't hear you.
Any particular brand that you recommend?
There are lots on Amazon available. They all are good. They come with a warranty, so you can just pick up any.
Great. And okay, next question. I have lost many of my teeth. Is dentures the only solution?
No, you can go in for implants. As I said, it depends entirely on your oral hygiene. Your doctor or your dentist would have to have a look and see that can you get dental implants done or not.
I think
And
this question is from a patient. I think she has little bit of, her jawline.
patches.
The jawline bones are, I think, very weak, if I'm not wrong. Mona, am I right on that part? Okay, she'll answer. So I think she has
Okay.
little
No,
bit
so
issues with
now
the
again, the technology has become dentistry has become very advanced, and people, even who have very weak bones or something, we can, in implants also, there are a lot of options. They could be denture supported implants, they could be independent implants, they could be fixed teeth. So there are various options which are available. So again, visit a good implantologist, because over just a basic dentist, an implantologist would be able to tell you, because this is what, like as an implantologist, this is what I do in and out. And I would know, that looking at you, looking at your bone condition, basic x-ray, tell me whether you are a candidate for implants or not. Is dentures your only option? Again, in your kind of cases, because if you have a lot of dry mouth, dentures might not be the best idea. So, some, because the denture retention is also somewhere related to your saliva, So, dryness, again, if you can restore with implants, it would be better than just going in for the denture way.
We have a question on oil pulling.
Okay.
What
So oil
does
pulling is
that
not bad. A lot of people do it. It's not so common in India, but I do get a lot of people from certain countries who do oil pulling. If it works for you, it works, See, I come from a medical background. I come from a dental background where we look more into the allopathic or the scientific aspect of it. If I as a dentist, I would not be able to recommend to my patients, okay, start doing oil pulling. But if it suits you, if you've been doing it, it's fine. I mean, I wouldn't say it's good or it's bad. like our experience is more related scientifically. So if you ask me, can I use a mouthwash? It's bad. I would say no, it's not bad. If you're using a Colgate Plaques mouthwash, not a medicated mouthwash, it's fine. It keeps your hygiene fresh, your breath fresh. So it's like that. Nowadays, how you have these sugar-free chewing gums. Now they like there are all these Orbit, and there are a couple of them which are these sugar-free gums, which probably may be good for you people because it would activate your salivation. So again, it's not bad. So if oil pulling suits you, you should go ahead with it.
Mary, the answer to your question is she said the Sensodyne, Mary, Colgate sensitive,
Uh,
Chai.
Colgate sensitive, Colgate rapid action, Sensodyne. Then for extreme sensitivity, there is a toothpaste called Thermosil RA. There is Hydent, there is Shy. There are a lot of ones which are now readily available over the counter. So if you have extreme sensitivity, you should look for these toothpaste which have called this rapid action, or they would have an extra edge. You could ask your chemist. And as I had even mentioned before, they take a little bit of the toothpaste, apply on the teeth, and leave it for a couple of seconds, say, or a minute, and then start brushing. For patients who have severe recession, like gum receding or something, and over the counter toothpaste, see, over the counter toothpaste are going to take you a couple of months. It's not that the sensitivity would go up, like go back immediately. But if anybody is experiencing extreme sensitivity and wants to have a slightly faster relief, we do make customized silicone trays and apply and recommend you some tooth mousse which have higher concentration of desensitizing agent. So what that silicone tray, it's like a bleaching tray. On that you put the mousse and it helps to hold the tray in position, and the mousse or the desensitizing agent is in contact and with your tooth surface, which helps in repairing the tooth surface faster. So if you have connect with your dentist, and they would be able to help you better with that.
Doctor, recently I had visited the ENT and he advised against using a tongue cleaner. So is using tongue cleaner not advised?
I don't see why an ENT would, um, you know, go against a tongue cleaner, because removal of the plaque again from the tongue is important. And in some patients with scleroderma, we do see a lot of white or a fungal
That's
chances
right,
of
yeah.
fungal infection coming. I don't, if you don't want to use the tongue scraper, like there are a lot of people who are not comfortable, you can even use your normal brush to clean your tongue. There's no harm in it, even a brush can do that. But if you are having any sort of white patches or something in your mouth, you should definitely, use a scraper to remove those.
Do steroids induce bacterial conditions?
Not really. I mean, but if there is, they could induce any long-term side effects, but not, they don't really induce any bacterial condition as such. See, steroid is something, which is, it enhances your healing. It fools your body to heal faster. In when we do a lot of dental implant surgeries nowadays, or even after wisdom tooth, we do give a patient sometimes, if it's a difficult surgery and we know that the patient is going to come up with like a big swelling, and socially you're working, you don't want to give up work, you cannot sit at home for 1 week. We have also started prescribing steroids to the patients, which are for short term, a very minor short term, so that it enhances the healing, it fools the body to heal faster. So I don't see it would induce a lot of bacterial accumulation or something.
How to prevent tongue plaque?
Again, tongue cleaners are important. Use your toothbrush. That's something, you should make it a practice if you feel there is a lot of accumulation.
Doctor, one more question is that, with scleroderma, there is a lot of D3 calcium depletion, and this is
Right.
something, right? Even, a lot of oral medications do not help us because our body does not absorb these
D3.
medicines,
Yeah, yeah.
D3, or even calcium for that matter.
Right,
So,
right.
then, what is the way for us to keep our teeth healthy? Because, what is required if our body is not
So
absorbing
a
it.
fluoride toothpaste is very, very important. That's why we say a good fluoride toothpaste. I am totally against Ayurvedic or these what the miswaks and the Patanjalis. I am totally, as coming from a background where I've done my master's in gum surgeries, I do not recommend these. They may make your mouth feel fresh, good, but at the end of the day, especially in your kind of patients, that where there is dryness, there has to be a certain amount of abrasive action of the toothpaste which has to be there. There has to be certain contents, like fluoride is very, so a fluoridated good toothpaste is very, very important. I recommend using a toothpaste versus a gel mostly, because a gel, like how you have these close-ups. So you have a toothpaste and you have a gel in toothpaste as well. So it's more important maybe to use a toothpaste over a gel, because the fluoride content and the abrasive action of the toothpaste helps to keep the surface or reduce the plaque accumulation and keeps the surface of the teeth more cleaner versus a gel.
So anything like a Colgate could be used.
Yes, Colgate Total, or and for you people, as I said, if you have a lot of gum recession, best is to go for a desensitizing toothpaste. They work the best. They have the desensitizing agent, they have the fluoride in it, so it works the best. There are certain mouthwashes which do. There is one Postler mouthwash do which we sometimes you give kids with braces because they are prone to cavities or something. It all depends how bad or good is your condition of the mouth. So there are specific mouthwashes meant for people where we see the enamel is weakening and everything. Again, that is something which is a medicated one, and your doctor would be able to prescribe you the best. I mean, you would have to visit your doctor to get the prescription for that.
Okay. Does fluoride in toothpaste or mouthwash interfere with thyroid functioning? I suffer from hypothyroidism.
The content of the fluoride in the toothpaste is that much that it does not cause any side effect. It is to a certain there is a government regulation or a company regulation that the toothpaste has to have this much amount of fluoride, and it does not harm you any other way.
Doctor, will you be kind enough to share a few exercises for the patients so that their mouth opens better for
So
them to even
the basic exercise is to put two fingers between your, so if it is first, maybe start with one finger, try to open, or best is to take two fingers. So it's like a scissor. You have to every day do this, repeat it 4 to 5 times in a day, and try doing this 10 times each time. So this is the best and the easiest exercise, trying to open the mouth. And it will take time, but it does help.
thank you. My jawline is coming down, it's receding, and my upper jaw is coming out. Is it a matter of concern?
Mm, I again now maybe it's because you've lost some teeth, or it could be, it's very difficult for me to say till I don't have a look, that what is the reason? Is it some medical condition, or is it related to your loss of tooth, or is it a part of aging? What exactly it is, we will have to clinically check and then be able to advise you.
Awesome. Any more questions, guys? Is it safe to use both normal floss and water floss daily?
Yes, it is. I treat a lot of patients who are expats who come from outside India, and trust me, we Indians do not have, I mean, when I say we Indians, including me, we do not have this habit of flossing. But they are so particular that when they get any sort of dental treatment done, whether it is functional or cosmetic, they make me use a floss to show them that yes, a floss is going inside the teeth. So if you can make flossing a habit, it is very good. You get rolls of floss nowadays, you get the toothpick floss as well. And if your gaps are too much, then a water flosser, using a like maybe like a power toothbrush, using a water flosser, all reduces your the reduces the plaque accumulation. So it helps you to maintain your oral hygiene, and your trips to the dentist automatically start becoming less. So these, I highly recommend use of a floss.
Probably doctors already answered this question that she does not recommend teeth whitening because it is
Yeah,
kind
if your
of
teeth are very sensitive, when your gums are receding, what kind of results you would get? One, that's questionable, and the sensitivity after teeth whitening can increase. Um, if you really are this thing, then one thing you should, what I can suggest is not the in-office teeth whitening, but the teeth whitening where you get these trays and you apply a gel, which has got only 10% of the whitening agent, 10 to 15%. You have to wear it for a couple of hours. It's a slow process. It takes a couple of months, but the whitening does happen.
should one floss before or after eating, after brushing?
Uh, After brushing, floss your teeth. That's what the routine goes, because once you have eaten, if at least after meals, if you're not able to brush your teeth, at least swish your mouth. You can use a mouthwash at that time, rinse your mouth. And then if you're brushing, then after that, you can start using a floss as well.
Thank you.
Are teeth affected? Something else is there?
Yeah, are teeth affected due to slightly
Yes,
high sugar
totally.
level?
Yes, totally. If you're asking me, that means in cases of diabetes, yes. Uh, there is diabetes directly affects the bone, and as the sugar level goes up, your oral hygiene, your gums could swell up, you could lose the teeth. And so yes, sugar levels do really affect the teeth, so if any patient who's diabetic needs to maintain the sugar level and have to be concerned of visiting the doctor for getting your oral hygiene maintained.
Thank you. Thank you so much, doctor, and thank you for your valuable time and input. It was a
Thank you
great
so
session,
much.
and I hope a lot of our patients have got their questions answered today because this is one area where people struggle a lot and they don't really end up going to a dentist because, as I said, narrow opening of mouth, and not everybody understands how these
Yes,
diseases can be dealt
yes,
with. Thank you for your
yes, yes.
precious time, and
Thank you,
that too on a
everyone.
Sunday.
And if there is any more questions, you could take the details from Ashmi. And if anyone needs any suggestions on any other medications or something, I would be more than happy to help. I have a practice in Khar West in Mumbai, very close to Bandra off Carter Road. And I will be happy to share whatever more information you want to.
Thank you. Thank you so much, doctor.
Okay, thank you so much.
Thank you, family. Have a pleasant
Thank
evening.
you. Have a pleasant evening.
Bye.